Hi. Hello friends, how's it going? Hello. Hi everybody, I'm G. If you don't know me, I hope you're here to learn more about me. Hello, how's it going fam? So as you can see by the title of this video, I'm finally sitting down to talk to you guys about my breast reduction surgery and the experience and everything in between. I'm really excited to do this one because I've been thinking about you guys and I wanted to vlog a lot of that process, but to be honest with you, I just didn't even know what to expect or what to what to look for or what was gonna happen after surgery. So I kind of just wanted to take it day by day. And anyway, I didn't do, a day-to-day video, but on TikTok, if you don't follow me on TikTok, go ahead and do that there. I give updates, a lot of updates on how I'm doing, day to day. I did the entire first week after surgery, I gave an update every single day. And then the 2 week when I got my stitches out, all that stuff. And I'm still making more and more of those videos, just kind of life after, because I even myself, when I was looking at all of that stuff, I didn't know where to look, who to ask, and what questions to ask. And there really wasn't anywhere that I could look. Most of the information online is for breast augmentation, so the opposite, in terms of what to expect, what is scarring supposed to look like. At this day, what should you be seeing? And if I see this on my skin, what should I be thinking? You know what I mean? Stuff like that. Just, and at home things aftercare and the bruising, all that kind of stuff. No one really talks to you about that. And obviously your surgeon can give you all of those answers, but when you're at home, you don't want to be bombarding your surgeon every single day because they have other surgeries and other patients and other things they need to be doing. I just hope that I can be a source of information for if people are looking into doing this procedure. This is something that I wanted to do since I was 17 years old and I'm 27. So yes, I have thought long and hard about this one. So don't even come at me with were you sure? I was more sure than I had been of anything in my entire life. Again, if I could have done this when I was 17, I think I would have. Truly, I can't recommend this surgery enough to anyone who's considering it or thinking about it, or if you're nervous about it or anxious, do it. I promise you're gonna thank yourself later and life will be so much easier in terms of your neck pain and back pain and just how you feel overall about yourself. Truly, this has changed a lot of how I see myself. Anyway, we'll get into the video. Without further ado, let's just jump in. First, how exciting. First of all, congratulations if you've decided to go ahead with your reduction surgery, or if you're just looking for information, congrats on being a smart, educated girly pap. This was something that, again, I just said I've wanted to do for a really long time, so it was something that I knew I wanted to jump into. I've been looking at things here and there along the years on information and researching, but never did I dive as deep as I did before I had this surgery and once I was looking into doctors and stuff. So the biggest, most common question I get about my surgery was it covered by insurance? And my answer is no, and there's kind of a reason for that. So with this surgery, because it's something I've been considering for like I said, 10 years, something I've been thinking about for a really long time. In order to go through your insurance, it's a very long process. Well, not extremely long. It can be covered by insurance, but it takes, I think, up to a year in order to even be given the okay to look for a surgeon that's in network for you. And that was something that I really wanted to have control over. I didn't want somebody else dictating what I was doing with my own health and what doctor to choose. And I know that I'm very lucky in this situation. I know that's not everybody's case. I know that I'm luckily very blessed, was able to have my parents help me out with this. If they hadn't, I think I probably would have had to have waited a lot longer to do this surgery, but I am so thankful and so glad that I took the route that I did because I'm kind of a control freak. With insurance, I know that you need to start with your PCP. Again, I'm not a doctor or an insurance adjuster or an insurance human, so I don't know the nitty-gritties, and I know there are a lot of girlies on TikTok that have gone through their insurance, but also because of the videos I watched from them, I chose to go the self-pay route. A lot of the girlies that did go through insurance in the US, I know in the UK and Australia and stuff, it's a little different, but in the US, from their experiences, their recovery was a lot more intense, a lot longer. And you need to start with your PCP if you want to go through insurance and kind of start that way. And if you have a good PCP, they'll kind of walk you through what you need to do or how it needs to happen in order to get it covered, I guess. I'm not a PCP, so I wouldn't know. When I started this journey, I just started researching surgeons. I went to about 4 different consults with different surgeons in my area. You want to make sure, first of all, that you find somebody who's board certified in plastic surgery. That's very important. And then also in aesthetic surgery. So it's not just plastics. You want to make sure that they're good at aesthetic as well, because it is an aesthetic situation. Like, you want it to look good. You don't just want it to be like slapped back together. Do you know what I mean? I went to about 4 different consults, and the surgeon that I ended up choosing was Dr. Rachel Walker. She is incredible. I love her. I'll put her information down in the box below. She truly, just like, her personality really meshed with mine, and she's very detail oriented. I can tell she really, really cares about her patients. Any question that I had, she was more than willing to answer, and she was more than willing to sit with me and talk through any questions that I had. She was never annoyed with my questions. She was never frustrated with me. She always took the time to listen and ask, like, is that okay? Do you understand what I'm saying? Taking the time to explain everything. And she just, at the end of the day, seemed like a human. Like, sometimes it's hard to find a doctor, or like a surgeon for that matter, who's super personable and super charismatic with their patients, and like actually cares about them as a whole person, not just like, okay, we're gonna do this to you and then like that's it. She just really seemed like someone who cared about her patients, and the entire experience from start to finish, was top to bottom, was incredible. She also included something in her package, shall we say, that other doctors didn't, was laser sessions for after you have surgery. So a lot of doctors will, you know, do your surgery, whatever it is, and then like you have scars on your yitties, if you will, and that's kind of like your thing to deal with. Like, obviously they'll give you, like, if you have a good doctor, they'll give you creams and ointments or a gel. Like, my doctor gave me a silicone gel. Then they're like, you're kind of on your own after that, like, gee luck. So that was something that I was like, oh, so like you're not gonna do anything to like fix the scars that you've created, even though I've paid for them. And Dr. Walker includes laser sessions after surgery. So I think at like the 3-month mark, if everything looks good and she clears you, you can start your laser sessions with her laser specialist at her office to like help with your scars and kind of like diminish them. And I've seen really good results from all of her photos, like her before and after, so I'm really excited about that. I also knew I wanted a female surgeon. After I had done my consults, I decided I want a female surgeon, because out of the 4 I did, 2 were women and 2 were men. And the 2 female plastic surgeons just had more attention to like the female gaze, if you will, or like the details that we focus on that men don't. Loved my doctor. She's incredible. Everything about her, I couldn't speak better or more highly of her. So once you choose your surgeon, after that, I did my first, you know, consult with her. It was great. And then I scheduled for my pre-op visit. So at your pre-op visit, you go in with your doctor, or sorry, your surgeon and your nurse, your scrub nurse, and she'll walk you through everything before surgery and after. And it's just like a lot of information, and they'll give you like a packet to take home with you, and all the things you can and can't do, and like when you need to stop taking certain medications before surgery, what you need to do before surgery to prep, and then things for afterwards, which I, you know, took to heart, and I did everything the exact way they told me to, bought all the things they recommended, because they're the experts and they know what they're doing, and they've been doing this for a while now. So I loved that appointment. It was a lot, I will say, and I think that's kind of when it started to set in. I was like, oh, like I'm having surgery, like I'm fully having a surgery to reconstruct my chest. And at the end of the day too, that's another reason why I wanted to choose my surgeon, was because it is a reconstructive surgery, and it's kind of a big deal. It's like right on, you know, in front of your body. You'll see it every single day, and you want to choose somebody who you trust to do that. And I trust Dr. Walker with my life now. Everybody at that office also did such a good job getting you excited, because it is kind of like nerve-wracking, and like I think you yourself kind of downplay it too, because you've just been thinking about it for so long, but that each person at that office just got you so excited for like every step of the way. Everyone's like, are you excited? Are you excited? Like, it's gonna be so fun. And it's true, because it is a big thing, and like you're choosing something for you. And I got so happy and excited to do something for me that I really have wanted for so long. After my pre-op visit with Priscilla, that was kind of the last thing. There were kind of full medications that I had to go pick up for before surgery and after. One thing that they have you take that I didn't hear from other people's experiences, you have to take this pill that's like an anti-nausea pill, because the nausea is insane. They give it to patients who are going through chemotherapy to help with the nausea, and that's kind of what freaked me out. I was like, the nausea is going to be terrible. Like if there's one thing I hate, it's being nauseous, because there's nothing you can do. There is nothing you can do to stop it. Like there's nothing you can do to get it out, like unless you throw up, or you just kind of have to lay there and wait for it to pass. It was fine. I took my medication the night before surgery, so I went to go pick up my medication, and I had to pick up this soap that I had to use. It's called HibaCleanse, so it's like an antibacterial soap that they use in surgery, like before surgery, just to kind of like sterilize everything. That was kind of it up until the day before surgery. So the day before surgery, the night before, you have to take a shower with that HibaCleanse stuff. You can take a shower however you want. You can wash your hair, you can use the soap, whatever, but that's the last thing you have to do. You have to use that soap to kind of wash everything else off of your body. So I washed my hair that night because I knew I wasn't going to be able to for a while afterwards, and I went to bed that night. The next morning I woke up, and I woke up before surgery because you had to take a shower before surgery again with that same soap, HibaCleanse. And this is what sucked. The night before, or sorry, the morning of, I took a shower with that same soap, and you can't do anything after that. You can't put on deodorant, no face wash, like nothing. You have to use that soap, and that is it. So it was like, use that soap, no moisturizer, no medications, no topicals, no serums, nothing. No contacts, like in your eyeballs. Like you had to go in like without anything on your body, like nothing at all. And it was terrible because every part of my body just was like, you know, like this, you know, your skin just gets really tight. That's how it felt. And I was like, I think I'm gonna throw up, but it was fine. And then you have to wear like loose clothes going into surgery. My mom and my dad both took me, and yeah, we went in there, and every single person that I interacted with at the office before my surgery was great. My other nurse, forget her name, I think her name was Charlotte, but she was my actual like scrub nurse who was with me in surgery. So my nurse came in the morning. She was great. She was like, are you so excited? This is going to be awesome. You're going to be so happy when all this is done. And I was like, I know. And then my surgeon came in, and she was just full of energy the morning of surgery, and she did all of like the drawings, you know, with the purple pen, and that was the worst of everything. Like it was on my body for much longer than I wanted it to be, but whatever. We can talk about how to get that off later. This video is gonna be so long, but I'm really trying to give you guys as much information as I possibly can, because again, I didn't know anything when I went into this surgery beforehand. Then my anesthesiologist came in, and she explained anesthesia to me, because a lot of people are obviously scared of that. And I guess I just watched too much Grey's Anatomy, so I was like terrified that I was gonna like wake up in the middle of surgery. And my anesthesiologist was like, that has never happened to me. It's very rare that that happens, and if it does, it's usually genetic. So if your parents have never experienced that, then you probably won't. And neither of my parents have experienced that, which was great. And she was like, trust me, you're gonna be fine. It's just gonna be like a nap. And I was kind of worried about like the IV. Not that I'm scared of needles, but like, an IV is just like a ginormous needle, and sometimes people aren't the best at it, but I should, you know that as a doctor, she was gonna know what she was doing. She came in, really calmed me down. She was so kind. My anesthesiologist walked me back to the OR. I laid on the table. LOL, that sounds wild. And it was heated. I was shocked. And then they just kind of started talking to me, and she put some like topical anesthesia. So like the gel that they put on your gums before they numb you for a cavity. And then she put in the IV, and I fell asleep, and that was it. I woke up, and I don't remember waking up at all. I remember getting home, and my mom was trying to like feed me something, because they told my mom that I needed to eat right away to like help the nausea go away. So I remember being at home and eating something after surgery, and to be honest with you, I felt fine the day of surgery. I went home, I took a nap, because obviously like the anesthesia like wears off, but you're still really tired. So I slept most of that day. Truly, like, it just felt like I couldn't take a deep breath, and like I had really worked out like my chest. Like if I had gone to the gym and done like a million chest presses, that's how it felt. It really was not painful at all. It wasn't like, I wasn't in pain. I wasn't feeling anxious or anything like that. I truly felt so great the day of surgery. Obviously at the end of that day is when the swelling started to set in. So like my boobs were literally like up to here. Like they were so swollen. It was insane. And I was like so scared, because I was like, did she even reduce anything? But obviously it's like all the swelling, right? And again, the next day after surgery, like I was truly fine. It's just like a level of soreness that you experience, but that's truly it. Recovery, at least the way my surgeon does it, was really easy and a breeze. I was able to go on walks like the day after surgery in my parents' neighborhood. I was able to just kind of like chill. I was able to make myself lunch. Like I was okay. You just can't really lift anything or like open any heavy doors. So I really needed my parents around most of the day to help me with things. In terms of like pain level, like I'd really say like a 2, because I was just sore. Like that was it. The worst part of recovery for the first day or 2 after is the nausea. That's really it. And as long as you take the medication your doctor is giving you, then you'll be fine. That's really the worst part. I really didn't want to take any of the anti-nausea medication because I knew that it would like back you up, so to speak. And I hate feeling like I can't go to the restroom. It is my biggest pet peeve ever of life, but luckily I didn't end up having to do anything too severe to counteract. That was kind of it. After surgery, like the 2-week post-op visit, she took out my stitches. That was a little uncomfortable. When your doctor takes out your stitches, like she literally takes the stitch, kind of pulls up in order to, you know, cut it, and then she cuts. So it kind of hurts because it's like, you know, sewed underneath in your muscle and your skin. So she pulls a little bit, she pulls a little bit, and then she cuts, but it's only for like a second and then it's done. It doesn't hurt. Like it's not painful. You're just kind of uncomfortable. Like probably don't touch that, but then she does. And once stitches came out, it was like I was a new person. I felt so much better. My surgeon used like, she didn't have us wear like she didn't have me wear like actual bras. I just wore bralettes, and I'm still actually only allowed to wear bralettes. I think she said that I can switch to underwire at week 8. I can't remember, but honestly, like I love the bralettes, so I don't really mind wearing them. I had foam underneath my boobs to kind of structure them and sit them up properly, but that, I hated that foam. And that's what really caused all of the itchiness that was like I was experiencing around like all the stitches and stuff. It was that foam, because I literally was wearing it 24/7, and like you sweat. So like you hold sweat under your boob, and it would just like drive me up a wall. And when it came time to take a shower and take off the foam, it was like my favorite thing, my favorite part of the day. That's really all I've got for you. It is a great experience. I'll make another video sharing like all my favorites, like bralettes and, you know, hoodies and zippies and like things that I was wearing after surgery to kind of just heal. Oh, now they're attacking each other. Okay, great. I think those birds were trying to make children. Okay, anyway, that's all I have for you guys. I hope you enjoyed this video. I hope it was informative. If I missed any questions, just comment down below or go follow me on TikTok or Instagram. I always answer on those. And again, on TikTok, I'm really giving more like day-to-day updates. So there's more information there if you want it. But yeah, I hope something good happens to you after you watch this video. If you're thinking about a reduction, you should do it. I believe in you. You're gonna do great. Make sure you find a surgeon that you like, okay? Don't skimp on that. It's important. I love you. Hope something good happens to you after you watch this video, and I will see you guys next time. Bye.